Hey guys, welcome back to my channel. If you are new here, please do subscribe so that you'll get notified every time I upload a brand new video. Let's begin. In this video, we are going to study acute sinusitis, which is the infection of sinus. So here you can see the picture in which a healthy sinus wherein there is no inflammation or no excess mucus found. So basically this sinus is involved in frontal sinus, sphenoid sinus, ethmoid sinus and maxillary sinus. So there are 4 types of sinuses. Whereas in case of sinusitis, what happens is there is an inflammation or the infection of the sinus which will cause inflammation of the sinus lining, and also there will be accumulation of or the excess accumulation of mucus. So the overview of this video is we will be studying about the definition of sinusitis, what are the types of sinusitis and who are most likely to get sinus infection, their clinical manifestations, that is signs and symptoms, also etiology, pathophysiology and diagnosis, and lastly treatment. So in this video we are going to study all of this. So what is sinusitis? So basically here you can see the picture wherein the frontal sinus is inflamed in case of sinusitis, and also there is a obstructed sinus opening. So there is obstruction in the sinus opening, and also there is accumulation of fluid or the mucus in the maxillary sinus. So basically the frontal sinus, the ethmoid sinus and also maxillary sinus are mostly involved. So basically what are sinuses? Sinuses are nothing but they are small air pockets which are located behind the forehead region, nose, cheekbones and also in between the eyes. So they are nothing but hollow packets or air packets which are located behind the forehead, nose, cheekbones and in between the eyes. So what these sinus will do is, this sinuses will produce mucus which is thin and flowing liquid, and this sinus or the sinus which will produce mucus that protects the body by trapping and moving the germs away. So basically it will act as a defense mechanism which will trap the microorganisms or any kind of pathogens which will move into the lungs. So basically it will trap those pathogens. So sometimes what happens is the bacteria or any kind of allergens cause too much mucus to form. So this mucus which blocks the opening of the sinuses. So obviously when the bacteria or the allergens they will cause too much mucus, so which will block the openings of the sinuses, which will lead to excess mucus buildup, and that mucus becomes thick and it will encourage the bacteria to grow and also other germs to grow or to build up in the sinus cavity, and this finally will lead to bacterial or viral infection. So most sinus infections are viral. There are few cases wherein the sinus infections can be caused by bacteria also, but mostly viral infection, the virus will cause the sinus infection and it will resolve in a week or 2. So basically virus infection, the virus will cause the sinus infection and it will resolve within a week or 2 without any treatment. But if it does not resolve within 1 or 2 weeks or 1 to 2 weeks, then we may consider it as a bacterial infection. So virus infection may resolve in 1 or 2 weeks, but if it doesn't resolve, then it may be considered as a bacterial infection and we have to move on to antibiotic therapy. So let's study the types of sinusitis. So basically we have acute sinusitis, subacute sinusitis and chronic sinusitis. So let's study the differences among these 3 sinusitis, that is acute, subacute and chronic. So acute sinusitis, it has the shortest duration and it will go away or it will resolve within few days, and the symptoms last between 1 to 2 weeks in case of viral, And in case of bacterial infection, what happens is the symptoms will last up to 4 weeks. So this is about acute sinusitis. Whereas in case of subacute sinusitis is the symptoms will last for up to 3 months. So, and this condition commonly occurs with bacterial infection, not with the viral. It will commonly occurs with the bacterial infections or some seasonal allergies. So, in case of chronic sinusitis, the symptoms last for more than 3 months. So, in case of subacute, it is for up to 3 months. In case of chronic, it is more than 3 months, which is less severe but can occur due to bacterial infection. And also, this chronic sinusitis may occur also alongside persistent allergies or some structural nasal problems. So, this chronic sinusitis can be of viral infection, bacterial infection, or also some allergies and maybe some structural nasal problems as well. So, who are basically more likely to or more prone to sinus infection? We can study in detail now. First possibility is a patient or an individual who has deviated nasal septum. So here in this picture you can see normal nasal septum is it is normal. In case of deviated, the nasal septum is slightly disoriented and that may cause sinus infection. And the second possibility is nasal bone spur. It is nothing but bone growth in the nose. Extra bone growth will be there in the nose. And third possibility is some nasal polyps. Polyps are nothing but non-cancerous cells or non-cancerous mass. See here you can see in this picture there is a formation of non-cancerous cells. So here in this picture you can see nasal polyps. And the fourth possibility is also history of allergies. If the patient is having history of allergy, any kind of allergy, that is pollen allergy, dust allergy, mite allergy, any kind of allergy, he is more prone to sinus infection. And the person who has weak immune system, obviously he'll have he has more prone to sinus infection. And the next one is tobacco smoking. This is mostly seen nowadays. The person who has the habit of smoking or who has the habit of eating tobacco, he is more prone to sinus infection. And if a patient has come to a clinic and if he says he has recent upper respiratory tract infection, then there might be a possibility of that person getting sinus infection. And then cystic fibrosis, which means thick mucus buildup along the mucous membrane linings. So there is a mucous membrane linings along in the nasal cavity. So there what happens? There is a thick mucus buildup will be there. So here you can see there is there is a healthy airway and also there is cystic fibrosis wherein the lining is filled with the mucus. And then the last is a patient or an individual who has a dental infection, then he is more likely to get sinus infection. So let's study the clinical manifestations or the signs and symptoms which a patient suffers from. So there is a nasal drainage. Obviously there is a nasal drainage or nasal clearance. There is a nasal congestion and also some kind of facial pain or pressure and headache. So these are most commonly seen nowadays in case of sinusitis. So there is a thick purulent, meaning pus or discolored nasal discharge will be there, which will indicate that it is a bacterial sinusitis. Then there are some non-specific manifestations or signs and symptoms which include cough, fever will be there and sneezing. So in case of sinusitis there may be toothache, but mainly in case of upper molars teeth, and also some kind of Halitosis will be there, which means bad breath. Next, in case of acute sinusitis, we are talking about acute sinusitis now. So what happens in acute sinusitis is the sinus will pain, or the patient will be having pain or pressure in sinuses, which often localizes to the involved sinus, only in the involved sinus only, that is preferentially maxillary sinus. And also this sinus will be red and swollen, and also it is extremely tender or on palpation, meaning when you touch the sinus, so on palpation the sinus will give us the pain, or it will be extremely tender, and the pain can worse when the patient is supine. When the patient is in supine condition, or when he is lying, so when you palp on the sinus, so it will be tender and it will cause more pain. So the manifestation of advanced sphenoid or ethmoid sinusitis. So if a patient is suffering from sphenoid or ethmoid sinus infection, then he may have severe frontal or retroorbital pain, that is frontal aerial pain, and also retroorbital is nothing but the pain in the or surrounding the eyes. And there are some life-threatening complications also when we ignore the sinusitis, or when we don't treat it well, then it will cause some life-threatening complications, which include meningitis, that is the infection of meninges, and epidural abscesses also will be there, and cerebral abscesses also will be there. So how does this sinus infection cause? What is the etiology of this sinusitis? So sinuses can arise from both infectious as well as non-infectious causes also. There are some non-infectious causes now, that is allergic rhinitis. Allergic rhinitis, if the patient is having allergic rhinitis, then he is more prone to sinus infection. This allergic rhinitis with either mucosal edema or polyp obstruction. If a patient is having allergic rhinitis with either mucosal edema or with polyp obstruction, then he is more prone to sinusitis. And then barotrauma, which the example include deep sea diving or air travel. If a patient is deep sea diving, or if he is air traveling, then he is more prone to sinus infection. And also if the patient is if he is exposed to some chemical irritants, then he can get sinus infection. So this ostium obstruction can occur with nasal and sinus tumors. So basically, when a patient is having nasal and sinus tumors like squamous cell carcinoma and some conditions which are leading to altered mucus content, that is cystic fibrosis. So if a patient is having squamous cell carcinoma, or if a patient is having cystic fibrosis, then he is prone to sinus infection. So in case of ICUs, so how the patient may have sinus infection is the nasotracheal intubation and also nasogastric tubes. So when you insert the nasotracheal intubation, the instrument, he may have sinus infection. They are the major risk factors. So there are some viruses which will cause sinus infection, and those include influenza virus, parainfluenza virus, and rhinovirus. So there may be the possibility of fungi which will cause sinus infection, and it will so basically this fungi will affect immunocompromised patients, and it will cause rhinocerebral mucormycosis. So basically it will affect the cerebrum region and will cause the mucormycosis. So how this sinus infection will cause to the body and how body will respond to it. So this is pathophysiology. So sinusitis is preceded mostly by a viral respiratory tract infections. We have seen in definition itself that the sinusitis is caused it is preceded by a viral respiratory tract infection that will cause the mucosal inflammation. So this viral respiratory tract infection can cause mucosal inflammation, upon which there is an obstruction of sinus ostia. The passage is, or the pathways that drain the sinuses get obstructed, which will cause the mucosal secretions that become trapped and local defenses are impaired. So basically, when there is a mucosal inflammation, it will lead to obstruction of sinus ostia, and which will cause the mucosal secretions to become trapped, and also the local defense mechanisms are impaired. They do not function properly, which will cause bacteria from adjacent or the surrounding surfaces to begin to proliferate. From there itself, the bacteria will proliferate, or they will grow, or they will divide to form sinus infection. So how do you diagnose this sinus infection? There are various diagnostic tests which the doctors follow, and the first one and a very common technique is physical examination of the patient. Here the doctor will check the pressure and tenderness by pressing a finger against the head and cheeks. So this is very common technique, very common diagnostic test. And so this physical exam also will examine the inside of the nose to look for any signs of inflammation, or to look for if the sinus is red and swollen or no. So in case of chronic cases, or if the patient does not resolve the signs and symptoms, then the doctor recommends imaging tests to examine the nasal passages and sinuses. So these tests, what they do is they'll reveal the mucus blockages, if there is any blockage of the mucus, and any kind of abnormal structures such as polyps. So basically this imaging test will help us to know if there is any mucus blockage, or if any there is a presence of polyps. There may be a CT scan also, which will provide a 3D structure of the sinuses. So from that we can study any kind of structural abnormalities of the nasal cavity, or something like that. And then there is MRI, which is magnetic resonance imaging, which uses a powerful magnet to create images of the internal structures of nose, through which we can study any kind of abnormality which is present in the nose. There is also fiber optic scope, which is a thin lightened tube, basically that is passed through the nose directly to visualize the inside of the nasal passage. So this is the tube which has a light in it, and which also has a camera in it. So that tube is passed through the nose directly to visualize any kind of structural abnormalities inside the nasal passage. And lastly, there is a nasal endoscopy for culture testing for the presence of any kind of infection. So this is also a kind of tube, the endoscopic tube, which will help us to understand the presence of infection. So now we must study the non-pharmacologic therapy. So basically the OTC medications include nasal decongestants. So these when a patient is having sinus infection, he will definitely have a nasal congestion. For those, we have to take nasal decongestants, which will reduce the inflammation by vasoconstriction, and the examples include phenylephrine or oxymetazoline. We can also use oral decongestants, which will reduce the viscosity of nasal secretions or the mucus. Also, we can use antihistamines, but these are not used nowadays, basically not used much nowadays. So, and these antihistamines are used due to their anticholinergic effect. These antihistamines can dry the mucosa and disturb the clearance of mucosal secretion. So basically, these are used due to their anticholinergic effect that can dry and disturb the clearance of mucosal secretions. We can also use glucocorticoids, which will help us, which will help to reduce the inflammation. And analgesics are also used, like acetaminophen, that is paracetamol, and ibuprofen. Lastly, we are going to study the pharmacologic therapy, which involves antibiotic therapy. So the first line antibiotics include amoxicillin in case of uncomplicated patients or uncomplicated signs and symptoms. So if the patient has treatment failure or therapy failure, or if the patient has prior antibiotic therapy in past 4 to 6 weeks, so for those cases we can give amoxiclav, that is amoxicillin and clavulanate combination, or we can also give any kind of cephalosporin classes. Second line antibiotics is any kind of oral fluoroquinolones is given, like ciprofloxacin, ofloxacin, etc. So if a patient is having non-type 1 allergy, then he can be given cephalosporin class. And if a patient is having type 1 allergy, then he has more options, which include clarithromycin, azithromycin, and trimethoprim sulfamethoxazole combination, or we can also give him oral fluoroquinolones. And last and the least is surgery. So when all the non-pharmacologic therapy and pharmacologic therapy does not work out, then definitely you have to go for surgery, which is surgical drainage of the mucuses, the sinuses. And we can also repair a deviated septum, and also we can remove the polyps. So this is all about sinuses. Thank you so much for watching. Please do like, share and subscribe to my channel, and I'll see you in the next video.